We are live,
Okay.
friend. Um, Welcome. I was just talking to Dr. Annie and saying that one of the things that the Dust Bunnies have been asking me the most for is, with our Health and Human Services Secretary being who he is and misinformation about medical stuff being just rampant everywhere, folks need to find more safe adults who can help them navigate what is actually like a legitimate health update and maybe a new best practice for their kids and what is not, what is garbage. So thank you for being with us, and everyone make sure you're following Dr. Annie so that you get these updates. How are you feeling?
I'm feeling optimistic, overwhelmed, terrified, motivated, exhausted, exhilarated, all of those things. But
Yeah,
I'm happy to be here with you today.
because in addition to being a pediatrician and a mom, you've now decided to run for office also. Why? Didn't you have enough to do? There wasn't
I
enough to
mean,
do?
have you heard of Lindsey Graham? That's
No.
why.
Oh my God. Yeah, that is so like there had to be a day where you were sitting in your home with all of the things you've already accomplished and still have yet to do. And you were like, you know what? I got to take Lindsey Graham out of that Senate seat. I have got to do something. What was that day like?
So relevant to the conversation we were just having, it was actually the day RFK Jr. was nominated to lead HHS. That was the straw that broke the camel's back. That was the day I said, you know what? I'm going to do this. It might not make a lot of sense on paper. I have 3 school-age kids. I have a career already that I love, but I can't sit on the sidelines while the Trump administration, enabled by Lindsey Graham and all these other Republican senators, is just, wreaking havoc on America's healthcare system and our public health system. And I just decided, like, yeah, I could wait 10 years until my kids are older, but what is this country going to be in 10 years if I don't do everything I can to fight in this moment?
That's something I'm worried about right now. And I think that Democrats have been, unfortunately, like nobody has messaged this really well. But we know that Mike Johnson just said that he's not going to include a vote for healthcare subsidies. What can you, like, in regular people language, explain to me what's going on?
Yes, I'd be more than happy to. So
Okay.
this isn't like an unprecedented, coordinated attack on every aspect of our healthcare system. If you back up a few months, first it was Trump's budget bill that will gut Medicaid, which is the largest insurer for children in this country. It funds, lots of nursing homes, rural hospitals, pregnant women. That will devastate access to healthcare in my home state of South Carolina and in so many parts of this country. So that was part of this coordinated attack. And, what Mike Johnson just did in saying that they're not even going to vote to extend the ACA tax subsidies is essentially removing so many people from the healthcare market. They're pricing out millions of Americans, hundreds of thousands of South Carolinians from the healthcare insurance market because these ACA tax subsidies simply lower the monthly premiums for people who cannot afford health insurance because
Mhm,
health insurance is too expensive. And I'll tell you why it's too expensive because
mhm,
it's profit motivated. America has built a healthcare system that is motivated by profit, unlike
mhm,
essentially every other developed country in this world. And that is why health care is so expensive. That is why health insurance premiums are so expensive. Yes, the healthcare system is broken, but allowing these tax subsidies expire will do one thing and one thing only, which is double, triple premiums for hardworking Americans, pricing them out of the health insurance market. They will drop their health insurance. But as a doctor, I know that just because you don't have health insurance doesn't mean you're not going to get sick or you're not going to get injured. So this is a devastating day for healthcare access for Americans.
I mean, I'm an independent business, right? And I remember thinking that my biggest fear of becoming an independent business was, well, how am I going to get healthcare? And then we signed up for through the marketplace, and for me and my wife, it was $1,700 a month. And I was like, there is no way that it has always been this way. There's no way that my parents back in the 90s like could have ever afforded this, and they had 3 kids and everything. And I was asking him about it. My dad was reminding me that there was a piece of legislation that came through in like the 90s that said that there was no more cap on CEO healthcare pay and that they didn't have to be nonprofits. They could be for-profit entities. And this is sort of when you started to see our cost rise. Well, the healthcare industry, and my mom was a nurse, safe staffing has gone completely down to the point that so many people have retired because they just can't handle it anymore. So we've lost incredible talent, people who care for people. And then I'm seeing like healthcare company owning sports arenas, putting their name on like all of it. I'm like, this is crazy. This is like
That's right.
a direct one-for-one comparison. What can we do to stop it, though?
So the glass half full Pollyanna in me is thinking, because this level of destruction is, so severe, that
Yeah.
it's forcing us to have conversations that politically too many of us were uncomfortable having, which is that we've just got to build a whole new system. And we have to build a system that is patient centered, not profit motivated. And short term, we need to refund Medicaid. We need to protect Medicare. We need to extend the ACA subsidies. We need to lower the cost of prescription drugs. But
Mhm,
long term, we need to get the profit motivation out of the system. And there's
mhm,
lots of ways to do that. One of the ways to do that was something Obama was championing back in the ACA debate time, which was a public option. If
mhm,
Joe Lieberman and the Republicans had allowed a public option to be part of the ACA, we would not be in this situation right now.
mm,
Because if you have a public option, then people like us, I'm on an ACA plan as well.
mhm,
We could choose to buy a private insurance plan, or we could choose to buy an insurance plan from the government. And the
yeah,
government is a nonprofit organization that would slowly force more competition. It would force the private insurers to offer higher quality, lower cost plans as more and more people chose the public option. And then eventually we would get to a point where people would say, you know what? This public option is working really well. Why don't we just put everybody on a public option? And you know what that's called? That's called universal health care.
right, and that's the end goal, right? And that's what a lot of other countries have. And people will complain and they'll say, in Canada and the UK, sure, sure, we've got universal healthcare, but it's not that great. What do we at least you have some base to start
Right.
with, like.
Right. I mean, that's the thing. Like, I'm under no illusion that a government-run healthcare system is going to be just meet every person's need and just be this wonderful healthcare system. But it is the best option for us right now. I am a practicing pediatrician. I've worked in hospitals for 20 years, and I can't tell you the amount of time I have to spend on the phone call with insurance companies defending the reason these patients, these children, are admitted to the hospital, the care that I'm providing, arguing for them to get this drug instead of this drug. It's exhausting. And the number of case managers that have to work in every clinic and every hospital just to navigate all these different private insurance plans, all the 51 Medicaid programs in this country, plus all the different versions of Medicare. It's just so overly complicated. And so much of the money we're pumping into the system as patients is not going to the provision of healthcare. It's not going to the doctors, the nurses, the lab testing, the MRI scans. It's going to pad the profits of insurance companies. And that is at the very root of the problem.
This is something my sister just went through. She just had her second child, and it was NICU baby. He's home now, which is like exciting.
That's
Everything's
great.
going okay for him, so yay for that. But my sister, who grew up middle class, whatever, one of the first people who visited her was a social worker, and she was really surprised by this. And they were like, "Your family needs to start to prepare for the cost of this, and these are some things you might qualify for." Meanwhile, she's just had this, critically ill child, and she's like never been visited by a social worker, and like it's like it's cruel. It's
Yeah.
sick and crazy what people go through, and we just don't even talk about it enough.
Yes, this is, it's an economic problem, but it's also a moral problem. It's a moral stain on America because healthcare is a human right. I've heard that story before of a brand new mom delivering a baby premature, or a baby that has complications has to be rushed to the NICU. And you're exactly right. These private insurance plans are not going to cover the bulk of that care, despite the fact that these people have insurance plans. And so that's when supplementary Medicaid often kicks in. And, there's this narrative, of course, from Republicans that Medicaid is just a handout program for people who don't want to get a job and just want to spend the afternoon on the couch playing video games. Nothing could be further from the truth. In my 20 years working in children's hospitals in 3 different parts of this country, including 15 years here in South Carolina, the majority of patients I have cared for have been Medicaid funded. These are children who have asthma and diabetes and seizure disorders, or who would get admitted after car accidents, or, of course,
Mhm,
gunshot wounds, because this is
mhm,
America. These children deserve high quality health care. And that's what the Medicaid program delivers. One of the programs I've been talking about on the campaign trail that we could start to feel optimistic about once we get out of this moment, this attack on our healthcare system, is what if we had a federalized program like Medicare, but for kids? Call it
yeah,
MediKids. And every child in this country under the age of 18 just gets access to healthcare, because healthcare for children costs fractions of a penny on the dollar compared to healthcare for adults. And if we invest in children's healthcare, they're going to be healthier when they're in the workforce. They're going to be healthier when they're retired and on Medicare. And
Mhm.
find me some politicians who would look you in the eye and say they don't want to provide healthcare for children.
Especially as they continue with these abortion bans and these "I'm so pro-life," then prove it. Let's do it.
Mhm.
Let's do Medicaid for kids. Like, say no to that, right? What
Exactly.
do you think, like, your skills as a pediatrician over the last 20 years are going to help you bring should you win this Senate seat to the government? Like, what's that? 'Cause I would love to know, like, how does a pediatrician transfer to politics?
Well, first of all, I would be the first pediatrician ever in the US Senate. And we have had 22 years of a US Senate with one Lindsey Graham and zero pediatricians. And I would argue it's time for a US Senate with zero Lindsey Grahams and one pediatrician. And that is all I'm asking. The other joke answer to your question is I'm a parent, of course, and a pediatrician, used to dealing with tantrums and toddlers and bad behavior. So I'll fit in really well in the US
Yeah.
Senate. But the serious answer is my job in a hospital as a pediatrician is to walk in every day, treat the sick or injured children in front of me, no matter where they come from, no matter their background, no matter their insurance status, their immigration status. And I work with whoever is there with me that day. And we solve the problems in front of us. When you're a doctor, you don't have the luxury of saying, well, that problem's too hard to solve, or I don't feel like doing that day, or this is too complicated, or to solve this problem, I'm going to have to work with a surgeon I don't like. You just get the job done. And what we're lacking in Washington, D.C. is people who are willing to just roll up their sleeves and get the job done. And I think we need far more serious professional people in all levels of government who are used to solving problems and don't want to play politics.
Mhm. I would love to have seen you at the confirmation for RFK Jr. as a senator because certainly you would have had the experience to ask questions that he couldn't have answered, and maybe it is that transparency and that expertise that we need to bring back to the Senate that's been filled with political celebrities and dynasty candidates. I'm totally with you on that. Speaking of, so much bad information is coming out from our health leaders right now, and it's scaring people, and like I said, my sister just had a baby, and she's like,
Mhm.
I still get them the hepatitis vaccine though, right? I still am okay that I took Tylenol, right? I'm like, yeah, Jen, of course. And this is my sister's very smart person, but she's like, it's overwhelming
Yeah.
to try and parse what's real from what's not. Like,
Yeah. I have so much empathy for parents navigating this right now because it used to be there were multiple sources of trusted health information, and we used to never question trusting the health information coming from the federal government or your state government. But that's just not the case today. I was talking to a local reporter last week, and I said that, like, you cannot trust the healthcare recommendations coming out of our federal government right now. And I mean that with every cell in my body. Not everything they're saying is false, but because some of what they are saying is not following the science, is not accurate, then we have to question everything.
mm,
And so there's so much for new parents to navigate, so much for all parents to navigate. But yes, the B vaccine is incredibly safe and effective at reducing the incidence of chronic liver disease, which is cirrhosis, liver cancer, etc. That is a wildly successful public health intervention. So yes to the hepatitis B vaccine, yes to the vitamin K shot, yes to the routine childhood immunization schedule that formerly was supported by the CDC, but is now still supported by the American Academy of Pediatrics, the American Academy of Family Physicians. So we're just going to have to shift the resources that we go to. The AAP has a great parent-facing website called healthychildren.org, has a lot of great information on it. I recommend that parents go there. I recommend that parents just talk to their trusted physicians. If they have access to a primary care provider, talk to them because individual physicians, by and large, are still following the science.
as a senator, as a congressperson, it's like you're supposed to be the voice of the people of that particular district. As a senator, you're really representing the state. Can you talk to me a little bit about how you would represent South Carolina and what work you think needs to be done to repair some of the damage that folks like Nancy Mace and Lindsey Graham have done to that state's reputation?
I mean, I don't even know where to begin. We just, if you think about who's in South Carolina's congressional delegation, it really is just a clown show, minus, of course, the wonderful Representative Jim Clyburn, who is a real pillar of South Carolina and has done so much good work in Washington, D.C. on behalf of South Carolinians. But, we just need serious people who have some expertise. And when they don't have the expertise they need to weigh in on an issue of the day, they seek out that expertise.
Mm,
Nancy Mace is a fool, and she's a climate science denier. She is just not a serious person. So I look to go to Washington, D.C. with the same approach I took to medical school, residency, and the practice of pediatrics, just serious problem solving, using the knowledge that I have, the resources I have at my disposal, seeking out expertise I don't have. But South Carolina has so many problems. We are on the bottom of every list you want to be on the top of, and the top of every list you want to be on the bottom of. It's very like basic things like our infrastructure is crumbling. We have bridges that are in disrepair. We have so many folks who are living paycheck to paycheck, living in poverty. We have food deserts. We have maternity healthcare deserts. Our infant mortality rate, our maternal mortality rate are sky high. We don't have access to affordable healthcare in the rural parts of my state. Our public schools are struggling. And we just have, a bunch of clowns representing us in Washington, D.C., and our state legislature is not helping. And I just look forward to being part of this generational shift in South Carolina politics because South Carolina wasn't always this way. We elected statewide Dems back when I was in high school. It hasn't been that long, and it doesn't have to continue to be this way. And one of the reasons I'm running, one of the reasons I'm able to still get out of bed every day and fight this fight despite being a Democrat in a state like South Carolina is I know my campaign is giving people all across the state something to feel hopeful about, and we deserve that.
I like the thought of having a doctor that could triage the problems of a state too,
Oh.
like understanding there are so many, but you're just trained to think in terms of like what needs to happen first, what can happen in tandem. What do you think your triage strategy would be when you get in first?
It's got to be healthcare. I mean, what
Healthcare
this
first.
this budget, what it's going to do to Medicaid will be devastating for South Carolinians. So it's getting in there and finding a way to repair what will be broken in the Medicaid program, providing more resources to rural hospitals and federally qualified health centers, restoring the funding of the CDC and the NIH, protecting Medicare, doing what we can to restore the tax subsidies to the ACA as a bit of a Band-Aid while we work towards building a patient-centered healthcare system. While also, so I can also, as a busy mom and a working pediatrician, I can also multitask. So while
Hmm.
I'm addressing the healthcare system, we'll also be addressing the affordability crisis that Lindsey Graham is totally ignoring and Donald Trump just called a hoax. The tariffs, I was just talking to a small business owner here in South Carolina, and I know I sound like a candidate now, but this is a real story. A small business owner who works at this really cool wine and cheese shop, or she owns a really cool wine and cheese shop. She said the tariffs have been devastating because most of their product comes from Europe.
Right.
She said the prices they're having to charge their loyal customers for bottles of champagne and cheese around the holidays are just not sustainable. And that's one example, but I've heard of small businesses closing all across the state. Farmers are really hurting, and we just need serious adults in the room. I'm not going to pretend to be an economist, but I understand the Trump economy is using America's economy for political theater, essentially.
Mm.
And we need to stop these on again, off again tariffs, provide some relief to small business owners, folks who are working in South Carolina's auto industry, our farmers, et cetera. And we just got to get this country on the right track.
It sounds like you know what you're doing, man. I mean, you have my vote. I live in New York here, but I'm like this. We had what I think is interesting and why I feel so optimistic about your campaign and so many people across this nation who are saying like, I just have to raise my hand and get in here as a professional because I think I could like help fix this and then hopefully not stay in politics forever. Maybe get back to
That's
pediatricianing
right.
after you fix things up. Is We had a guy here I live in Rochester, New York, and he ran as Jeff. He ran on the Democratic ticket, but he flipped a seat that's been held by Republicans for 150 years. And he ran because very similar to you, he was like, look, man, this is where I live. These are the people I love. I go to the same restaurants you do. My kids go to the same schools you do. And we just got to get this together, okay? We can't be doing this partisan thing. I have the skills to fix what's going on in this town. And if you just vote for me, vote for me. And he won by like a landslide, which was never
Wow.
heard of, up against an incumbent. And that's the sort of hopefulness I have for folks like you who are across the country, really just trying to be like, I don't even want to run for office, but I feel like I have to so that I can, help in the ways that I can serve my country in that way and then get back to doing what I was doing before.
Yeah, I mean, I truly see politics as a path to solving the problems I see every day in the children's hospital. I never
Yeah.
sought to be a politician. I certainly don't want to be a career politician. I will term limit myself. I guarantee being a pediatrician is a more fun job than being a U.S. senator. But politics came for my profession. Politics came for America's children. And I can't stay on the sidelines and not fight back. And the only way to fight bad politics is by getting political. And far too many folks in my profession, too many pediatricians, healthcare providers are staying on the sidelines. They're staying quiet. They're staying apolitical because they think that's what they need to do as practicing physicians. But nothing could be further from the truth. You know, they are attacking the foundation of children's healthcare in this country by devastating Medicaid funding, attacking the routine childhood immunization schedule. They are, a coordinated attack on our healthcare system. Physicians, healthcare providers, scientists all across this country have to stand up and speak out because we might not have another chance.
And it's just not something that Lindsey Graham can do. I mean, like,
No.
maybe a lot of people liked him for the last 22 years, but you have to have a medical professional in there to fix a medical problem, right? You can't, it's illegal to practice medicine without a license. Why is it not illegal to destroy the healthcare without a license, right? Or make these cuts? It's crazy to me. Now, do you think you'll be able to work with the other senator from South Carolina if you guys are both in there? Like, what's your plan to try and like build the united front for South Carolina?
So I'll work with anybody who's willing to work on behalf of South Carolinians. Just like my job in the hospital, it doesn't matter if I like the surgeon who's on call that day. I need the surgeon, and the patient needs the surgeon and I to communicate and to work to solve the patient's problem. So I'll do the same thing. But I do have to say, when I unseat 22-year incumbent Senator Lindsey Graham in November 2026, there will be no one more afraid than Tim Scott, because he'll know someone will be lining up to come for his seat next. So I have a feeling he'll find the bipartisan spirit deep inside of him and be very willing to work with me to solve problems on behalf of South Carolinians.
He'll have to. He'll have to, man. And I'm hopeful to it. It's been such a joy to chat with you and to learn from you. Let folks know where they can find you, support your campaign, learn more about your policies.
Yes, so the campaign website is drannieandrews.com. We're undergoing a big expansion of the website right now. That should be out very soon, but you can see some basics about who I am and, my position statements. I'm very active on social media, Instagram, and all other platforms. Most places I'm Annie Andrews, MD. Find me there. I'm creating content nearly every day talking about the political issues of the day, talking about the measles outbreak in the upstate of South Carolina, this coordinated attack on our healthcare system. So that's the best place to figure out where I stand on issues. But we will be expanding our website soon. Please follow along, sign up to volunteer. You can phone bank and text bank from anywhere.
Anyway.
And, just if you want to fast forward to November 2026, imagine you're watching the election returns come in and all of a sudden they say, breaking news, we're about to call the Senate race in South Carolina. And instead of Lindsey Graham's face, my face pops up on your TV. And imagine how amazing that will feel, especially if you help to make it happen.
Absolutely. And for folks who can't vote for you, like you said, you are giving that missing context that the federal government just isn't giving, and talking about things that are affecting the state and beyond, like the measles epidemic or what vaccines are safe or what child health care looks like right now. So I appreciate that so much. Just as a person who myself is trying to figure out, like, what do we do for our kids? What is safe? What's not safe? Like, am I going to run into problems at the hospital or with the doctors? And how will I communicate that? How can I be an advocate for kids when you're not sure what's going on and you can't trust what the government's telling you? So I
That's
appreciate
right.
what you're doing so much. Thank you.
Well, thank you so
Good
much
luck
for
out
having me. I
there.
really enjoyed it.
Yeah, hopefully we'll have you back too as things get going.
That would be great. Thank you. Have a great
See you
week.
later. Thanks.
Bye.